Hello and welcome. Today we're diving deep into a condition called ischemic colitis. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started on understanding this important digestive disease. Ischemic colitis occurs when blood flow to the colon, or large intestine, is reduced. This reduction can be caused by a variety of factors, most commonly by atherosclerosis, the hardening of the arteries, which narrows the blood vessels supplying the colon. Other causes include low blood pressure, heart dehydration, blood clots, surgeries that interrupt blood flow, or even certain medications that constrict blood vessels. In rare cases, intense exercise can also contribute. When blood flow to the colon is inadequate, the colon's cells are deprived of oxygen and nutrients. This deprivation can lead to inflammation and damage to the colon's lining. The severity of the damage depends on the degree and duration of the blood flow restriction. In mild cases, only the inner lining or mucosa is affected. In severe cases, all layers of the colon wall can be damaged, potentially leading to ulceration, bleeding, or even bowel perforation. As the body attempts to heal, scar tissue can form, leading to strictures, or narrowing of the colon. Ischemic colitis primarily affects older adults, typically those over the age of 60, due to the increased prevalence of atherosclerosis and other age-related conditions. However, it can occur in younger individuals, particularly those with underlying health conditions like low blood pressure, clotting disorders, or those using certain medications. Statistics show that the incidence of ischemic colitis is increasing, likely due to the aging population and improved diagnostic capabilities. The symptoms of ischemic colitis can vary depending on the severity of the blood flow reduction. The most common symptom is abdominal pain, which is often sudden in onset and located on the left side of the abdomen. Other common symptoms include rectal bleeding, often described as mild to moderate diarrhea, an urgent need to defecate, and tenderness in the abdomen. Some individuals may also experience fever and nausea. Diagnosing ischemic colitis typically involves a combination of medical history, physical examination, and diagnostic tests. A doctor will ask about your symptoms and medical history, including any medications you're taking. Blood tests can help to identify signs of inflammation or infection. Stool tests may be performed to rule out other causes of colitis, such as infections. The most definitive diagnostic test is a colonoscopy, which allows a doctor to visualize the colon and take biopsies for further examination. In some cases, a CT scan may be used to assess the blood supply to the colon. While ischemic colitis isn't typically divided into specific types, it's often categorized based on the severity and duration of the condition. It can be described as acute, meaning sudden and short-lived, or chronic, meaning long-lasting. The extent of colon involvement can also vary, with some cases affecting only a small segment of the colon, while others involve a larger portion. The treatment for ischemic colitis depends on the severity of the condition. Mild cases may resolve on their own with supportive care, such as intravenous fluids to prevent dehydration, pain medication, and bowel rest, which means avoiding solid foods. More severe cases may require hospitalization for close monitoring and treatment. Antibiotics may be prescribed to prevent infection. In some instances, surgery may be necessary to remove damaged or dead tissue, repair perforations, or bypass blockages. This usually involves resection of the affected colon segment and potentially a temporary or permanent colostomy. While there's no foolproof way to completely prevent ischemic colitis, there are steps you can take to reduce your risk. Managing underlying health conditions, such as high blood pressure, high cholesterol, and diabetes, is crucial. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also improve overall cardiovascular health and reduce the risk of atherosclerosis. Staying well hydrated is also important, especially in older adults. Discussing potential risks with your doctor if you are prescribed medications known to constrict blood vessels is advisable. The prognosis for ischemic colitis varies depending on the severity of the condition. Many individuals with mild cases recover fully with conservative treatment. However, severe cases can lead to complications, such as bowel perforation, stricture formation, or chronic colitis. Recent research is focused on identifying biomarkers that can help predict the severity of ischemic colitis and guide treatment decisions. There is also ongoing research investigating new medical and surgical approaches to improve outcomes for patients with this condition. Emerging technologies for non-invasive monitoring of colon blood flow are also being explored to diagnose ischemic colitis early.